As the number of cases rise, hospitals are being stretched thin. Larger hospital systems like Baptist and UAMS can handle the load better, but rural hospitals are seeing their resources stretched to the max. Our Jay Burr talked with one CEO today about how they're coping. Jay?
Yeah, Laura, at this point, it's day by day. Now, many of those hospitals are used to working with less than some of the bigger urban facilities in the state, but with recent numbers the way they are, it's taking a much bigger toll on their operations. Magnolia Regional Medical Center CEO Dr. Rex Jones says his hospital is feeling this most recent spike in COVID cases, even if on the surface the numbers don't look menacing.
Whenever you see a spike, you think, well, that number in a population of 3.5 million plus, it's not that big a deal. It is that big a deal in the system itself.
Magnolia RCM has seen more people admitted in the past 2 weeks because of COVID. Dr. Jones says 40% of his patients are COVID related. They have prepared as much as possible to be able to handle this patient load.
The inability to find beds to transfer patients to has become a bit of a problem. And so they recognize that okay, we're going to have to take care of more patients than we're usually comfortable taking care of.
State officials have long talked about hospitals' abilities to expand if needed. Dr. Jones says for his hospital and many other rural ones, that expansion is not supposed to drag out like it has.
By and large, the majority of us, our plans are geared towards short-term crisis. And so this does wear on a little bit.
Another thing stretching workers in rural hospitals is people wearing multiple hats. Dr. Jones says urban hospitals can adjust better because they have more chess pieces to handle any influx, which is not the case for some of his administration staff.
There is no, 3-person department that if you pull one out, 2 people are still going to be able to handle it. It's whenever I pull someone out, it's that work is going to have to get done eventually by somebody.
Now, Dr. Jones adds smaller rural hospitals normally operate a little thinner in order to stay afloat, but since they've had to operate in this way for so long, rural hospitals have now lost much of that buffer in their margins. Laura?